Continuation with angular movements. Angular movement examine an increase or decrease the angle at a joint. Flexion versus extension. In flexion, there's a decrease in the angle between the bones at a joint, whereas extension is there's an increase in the angle between the bones at the joint. Let's examine the two images on the left of the elbow. In the case of the elbow, when you flex at the elbow, you decrease the angle between the bones of the arm and the bones of the forearm. When you extend at the elbow, you increase the angle between the bones of the arm and the bones of the the bone of the arm and the bones of the forearm. Now, in the neck, we can also do what's called flexion of the neck, which means we bring our neck forward, our head forward, not our neck forward, we bring our head forward. Okay, so you bend at the neck, you bend more anteriorly at the neck, so the head comes forward as though you're praying before the exam. So if I were to ask you on the exam, which movement is performed as you pray before the exam, and the answer would be flexion. Now, as you bring your neck back up to be in the anatomical position in the middle, you can see the head is going back up. In this case, this is going to represent what's known as extension. When you bring your head back, all the way to the back, you are moving what's called hyperextension. So hyperextension means that movement of extension past the anatomical position. So past the anatomical position. So once again, is that when you bring your head forward, you are doing what's called flexion of the neck. When you bring your head back, so you are in the anatomical position, you extend your neck, and when you bring your head all the way to the back as though you want to see up, look up into the sky, you are performing what is called hyperextension at the neck. And it goes the same thing with the trunk as well as this. When you flex the trunk, that means that you bring the trunk forward. When you extend the trunk, that means you bring the trunk back up into the erect position. When you hyperextend the trunk, you bring it back, so as though you can look up into the sky without moving your head. Now, not all joints can hyperextend. For example, the elbow and the knee have the same design. So the elbow and the knee can only perform flexion and extension. So I want you to try to perform flexion on your knee and extension on your knee. I'm going to wait. I'm very patient. I'm going to wait so you can perform the actions at the knee. Flexion, bend your knee. Extension, straighten out your knee. Same thing with the elbow. Flexion, bend your elbow. Extension, straighten out your elbow. But you cannot hyperextend the elbow nor the knee. Hyperextension could be done within the neck, within the spine, within the shoulder joint, and within the hip joint, just to name a few. So once again, flexion versus extension. Flexion is to decrease the angle between the bones and the joint. Extension is to increase the angle between the bones and the joint.